I guess our first experience with Lakeview Hospital was when our daughter Sarah was born, and that was in November of 1976. It was a wonderful experience, and the folks at Lakeview, of course, made that a terrific time for us. Having a hospital like Lakeview as part of your community just makes the community that much better, and it really adds an enormous benefit, I think, to the folks who live in the area.
I remember the real old hospital on the corner of the old brick building when I was a kid. Mother joined the nursing program, and they had to live in the nursing residence right next door, and she lived right down on 4th Street, but oh no. Miss Strom was who ran the ship, ran a tight ship, and all the nurses had to stay right at the house.
Well, I had to decide to be a nurse, first of all, and that just seemed like a good fit to me. I like taking care of people. The clinic that I first started at, I was there for maybe a year, and then we built up on Curve Crest. And then my mother, she started working in the dietary department probably about 28 years ago. And she retired 3 years ago, but she still works occasionally.
What really makes Lakeview unique is the people. And our people are passionate for what they do, and they care. And you know what's also unique about Lakeview is it's big enough to really be an effective hospital and healthcare organization, but it's really small enough that people still care about the individual.
You know, one of the things that keeps you here is the people. I mean, I've worked here for 25 years, plus I've known people ever since '62. There are still a few hanging on. And they're really great people that work here. And then my dad retired, and his patients still come up to me and say how much they missed him and how much he meant to them. And it's just, people love the care here.
Well, I was born at Lakeview, and all of my care when I was growing up was from Dr. Powell, so I knew the family medicine department here very well. Family medicine is practiced most in smaller, medium-sized communities throughout the country, and Lakeview is a community hospital that does an exceptional job of providing care for its community. I think Stillwater as a community is a more complete city, a town, because of Lakeview. I think a hospital is an absolute necessary entity for any thriving community, and so I think Stillwater would be very different if Lakeview wasn't here.
My family has been in Stillwater for generations. I'm actually the 4th generation out of 5 that has gotten care at Lakeview. Lakeview is unique because being in a tight-knit community like Stillwater, it really reflects the values of the community. News that no family ever wants to get is that a loved one has cancer. Lakeview has been there through each level of his treatment, and you know, it's just such a blessing to know that they're here for us. They have that small town mentality and just that friendliness that you rarely see at some of the larger organizations. And so it's a great place to know that you're going to be provided great care and that you can place your trust in the providers.
Ten years ago, I was diagnosed with prostate cancer. We found it kind of late, so at this point in my life, I'm stage 4 metastatic prostate cancer. Well, you know, when I went to the U of M, it was for one of the new medicines that was not available here, and ultimately it didn't work. But when I was there, they were wonderful and nice, but it's nothing to compare to Lakeview. The thing is, you get really close to your oncology, the infusion nurses. Sandy and Sue and Mary and all the wonderful gals, they're just, they call me at home, I can call them anytime, and they help me through everything. I get such a personal treatment here. Everybody knows me and they treat me so well.
I think the thing that makes Lakeview unique compared to many organizations, our commitment to the AAA aim, really a focus on a high level of quality to the patients we serve. I think what I'd like the community to remember about Lakeview is, number one, I think, is our commitment to the community. But in order to provide the level of care and maintain that commitment, it's really a two-way partnership. And the commitment that we have had with the community and the need for that commitment going forward, and that we do need the ongoing support that this community has been so generous with over the last 130 years in order for us to achieve the vision that we have for this organization going into the future.
I'd say it's a very good hospital with personal care, and it's a small town feeling, but still you're connected with all the bigger, important, or, you know, more difficult things close by in the cities. It's got the best of both. I really hope it stays as a small town hospital feel. That's what I think is good about it, and according to all the ratings, they're one of the best around, so that's really good. I think you get a combination of both.
We have a history of very strong partnerships in the community, and my hope is that we will continue offering more partnerships, more specialty care. What I really want people to know about Lakeview is what we do at Lakeview, we do very well. What we don't do very well, we have a partner called Regions Hospital, and we will provide that care at Regions. So we have the best of both worlds. We're very good at what we do. We're excellent at what we do. We have, again, the best patient satisfaction in the Twin City metro area. We have some of the best quality outcomes in the Twin City metropolitan area, and we're very fortunate to have the healthcare delivery system we do in the city of Stillwater.